The second thing is, if you are the person that, this doesn't really sit right with you, you don't feel like you're really buying into it, and that's fine.
Yeah.
It is challenging those beliefs, being aware of that belief that you're holding and challenging and asking why. Why doesn't this sit right with me? Is it just because it makes me uncomfortable? Is it because I don't believe, numbers and metrics have a place in healthcare? Okay, which is usually the way I've heard it represented most of the time. Um, and how can I challenge that and go and learn more and
Mm.
learn more about it? And it comes back to, what you said about the university lecturing. That's why they do tests. That's
Yeah.
why everything comes to it. It comes back to what I said about, healthcare is based off numbers and stats. It's evidence-based practice. It's evidence-based practice. It is statistically proven if something works or doesn't work, and that's how we know. All right. So if you have a practice that you're working at that doesn't track patient outcomes, right? How do you know? It's about taking away assumptions to care and leading us to facts of care. And in healthcare, it's about turning possible outcomes into probable outcomes if we can control something.
Mm. Oh, that's what it's all about. It's about the outcome in the end, and you get more predictable outcomes when you know the numbers leading up to a particular result. I had someone on one of the Facebook pages who has a PhD, and they
Mm.
were making really negative comments around, evil owners that use KPIs and numbers and metrics. And I went, oh, wow. I was going to send them, I was going to post, but I don't normally post a smart ass comment to someone who's already started negative, because you just end up in this big hole
Yeah.
that don't want to go down.
Spiral. Yeah.
But I was
Yeah.
going to say to them, oh, so right. So I didn't realize when you got your PhD, you just hang around the university for 5 years and they just give you a piece of paper that has PhD on it. I
Mm.
assume there's some numbers and metrics involved in any PhD.
100% it would be. 100% it would be. It's to prove that something works,
Yeah, they'd be
right?
crunching so much
Or
data.
disprove it.
Yeah.
Yeah, that's all it is. That is all it is. It's just data to help us create great decision making. That is really the end of the game. It's not the goal. It's not the goal of going out and dispensing 90% of orthotics to new patients. It's not the goal of going out and I'm going to rebook 90% in. The goal is to give great patient care, to make sure that we're not over servicing because it's damaging. So if we're rebooking 100% of patients in, we're over servicing,
Yeah.
and you're probably going to get a bad reputation for that, but also you're going to harm the person. But at the same stage, if you're not measuring and you're rebooking 60% of patients or 50% of patients, and they're walking out the door, and you're going, you know what, I did a great job, I fixed them, fantastic, go me. But you're assuming that some of those people actually haven't got a result. They've walked out the door. We've made assumptions, but we can't track it. You can't track it. You just believe that what you did worked for that person, and it's reinforcing negative behaviors. That's
Mm.
actually getting bad outcomes. So it's all got to be about patient care and their data sets to inform decision making. They're not the goal of what we do.
Yeah, I think there's two parts to it. I think some people have heard, the mythical stories where somebody works for a particular company, and I've heard it mentioned where this one particular big corporate company says to their podiatrist, you've got to do 20 pairs of orthotics this month, and they come
Mm.
down on with a stick if they don't do it. It's like, well, you can't get 20 orthotic patients if you're only seeing 10 patients that potentially could get an orthotic. It's an
Yeah.
impossible measurement. And
Yeah.
if that is what's being said to people, then they need to grab their patient list, go to their superior, sit them down and go, show me how you could potentially get 20 orthotics out of a list that there's only 10 people that could potentially get orthotics. And I think if you showed it to them, they'd start going, oh, actually, never thought about that. You're doing a great
Yeah.
job.